Hello, I'm Vern Cole, founder and client of the Hair Restoration Institute. And I'm here today to present the medical modality of hair restoration with Dr. Ken Sanders. Welcome, Dr. Ken, and thanks for joining me today.
Thanks, Vern. Glad to be here.
Dr. Ken, I have you here today to speak to any viewers who may be considering doing a hair transplant procedure and to answer the frequently asked questions. Also to give them your background so they know who would be performing their hair transplant procedure if they chose to move forward. So that being said, can you give your background and a brief bio of yourself?
Well, I'll go back to my medical school training. I attended Louisiana State University Medical School in Shreveport, Louisiana. And I started that school in '91, finished in '95, then took an otolaryngology residency and a facial plastic surgery fellowship that was completed in 2002. I became board certified at that point in facial plastic surgery and have since developed a special interest in hair transplants.
So if it's determined that a person is a good candidate to have a hair transplant, that is that they have the appropriate donor hair to contribute to the thinning or balding area, and they have realistic expectations, why would somebody want to consider a hair transplant over a different modality of correcting the hair loss problem?
Two things I've also noticed is that when people are deciding whether hair transplant is right for them, some people don't want a large amount of hair transplant done. They don't need it. So we can really tailor a transplant procedure to each particular patient, whether they just need small touch-up procedures done to bring back their youthful look, or whether we need to do a full reconstructive procedure that is going to be lots of hair transplanted and filling in a large area. However, due to the gradual, slow, natural growth of the hair, these people then don't have no hair one day and then the next day go to a meeting at work and have all of a sudden a full head of hair.
So we mentioned the donor area. Explain how the procedure is done.
With my technique for hair transplant surgery, what we do is we use the hair from an area that will not usually fall out. I mean, think about it, Vern. Even the baldest guy you know still has this horseshoe of hair that is not going to fall out. Those hairs are resistant to hair loss. We take the hair from this resistant area and move it to an area that's balding. The donor area is where these hairs come from. That area is repaired, and even hair as short as mine, immediately after the repair, you cannot see that anything was done. Then these hairs are dissected. The individual follicles are taken from that tissue. While this tissue is being dissected, I will have made the recipient sites into the balding area on a plan that the patient and I have agreed upon, and the grafts are placed.
So I've had a few transplants done, and I've seen the procedure done hundreds of times prior to my experience. So when I was ready for the injection and the numbing agent, I was holding on to my chair for dear life. After the first injection, I remember saying to myself, wow, if this is as bad as it gets, this is going to be a walk in the park. It was no big deal at all, and I found it actually similar to going to a dentist, actually easier. It just took a little longer.
No, Vern, it really should not be painful. The way I do this, we use a vibration device during the injection. We use a very tiny needle and a special buffered solution for injection that people can tolerate very well, and it truly is virtually painless.
So we have to discuss the potential complications. So can you speak to the audience, about the potential complications?
Well, with any procedure, there's a risk of minor issues. Some of the very minor ones are some scabbing. You're going to have some scabbing of the recipient area where the grafts are actually placed. We're going to have a little bit of swelling, and that typically, even in a worst case scenario, is only a couple of days. The swelling is usually handled by positioning. We talk about positioning of the patient after surgery. We also prescribe some steroid for a couple of days to minimize the fluid shift into the area of surgery. People always ask about a scar, and anytime we make an incision, there will be a scar. However, it should be almost invisible. And I tell people that commonly they tell me that their hairstylist has trouble even finding the incision line. Something else we see sometimes are ingrown hairs. The skin heals very rapidly, and sometimes it'll heal right over the top of one of our grafts, and so now that hair is ingrown. And you treat that simply by popping it a little bit, like a pimple, really. So infections are very rare after hair transplant surgery. We will try to minimize the risk by giving a prescription for antibiotics around the time of surgery.
Why would somebody want to consider HRI to do a hair transplant procedure?
HRI is a multimodality clinic. So while most people can be candidates for hair transplant surgery, some are not. Some may be candidates for the dermal lens non-surgical procedure. They use non-surgical treatments for either one of these type of patients, such as the MEP90 laser or topical treatments for hair loss. No matter what type of person comes in with hair loss, there's a treatment plan for them at HRI. It may include surgery, it may include a dermal lens procedure, and it may include some sort of a non-surgical medical procedure such as laser. Another thing I've found with HRI is they kind of go the extra mile for the patient. If a person decides to have a hair transplant procedure, they will offer a complimentary hair styling, haircut. They will also offer complimentary laser treatments to help aid in the healing and aid in the hair regrowth. So these are just some of the few things that I've noticed and really like about HRI.
So there you have it, everyone. Dr. Ken Sanders. Thanks for joining us today, and we hope to be seeing you in person in the near future.